It's really horrible. It's something that is historic. It's nothing like we've ever been through in the last 102 years.
After a year of devastating loss, signs of hope.
We can control the things that we can control, and we can manage our way through this. We know what works.
Hundreds of thousands of Hoosiers now vaccinated for COVID-19.
I hope it keeps me from getting it.
The number of positive cases across the state falling.
Thankfully, trends continue to head in a good direction, the right direction.
And restrictions slowly being lifted.
I just have to thank all of us in our community who've just made extraordinary efforts to practice safe infection control.
Optimism here in the Hoosier State and across America.
Let this not be a story of how far we fell, but of how far we climbed back up. We can do this.
From Wish TV, your local news source, this is a News 8 special, Overcoming COVID.
Good evening, everyone. Thank you so much for joining us for this special edition of News 8. I'm Brooke Martin.
And I'm Phil Sanchez. Saturday, hard to believe, will mark 1 year since the first case of COVID-19 was confirmed in the state. Today, more than 660,000 Hoosiers have contracted the virus.
Yeah, it was on March 16th when Indiana Governor Eric Holcomb announced the first Hoosier to die from COVID-19. Roberta Shelton lived on the east side of Indianapolis. Her death, the first of more than 12,000 in the last year in Indiana. Across the country, more than 500,000 people have died because of COVID-19.
So over the next hour, we have invited experts from across the area to join us for an in-depth conversation focusing on vaccines, mental health, education, and the economy. Our goal, not to look back at where we've been, but rather look forward at what's to come.
Okay, so we want to begin tonight with the COVID-19 vaccine. More than 600,000 Hoosiers have now been fully vaccinated.
While the vaccines do bring some hope for many, they are also the source of many questions and debate. And joining us now, Dr. Virginia Kane, Director of the Marion County Public Health Department, Kristen Kelly, Nursing Director of Infection Prevention at IU Health, and Dr. Ram Yaleti, Executive Vice President and Chief Physician Executive at Community Health Network.
Dr. Kane, let's start with you this evening. You got your COVID-19 vaccine today, along with Indianapolis Mayor Joe Hogsett. Talk about the process, what it was like, and how you feel now.
So I think the process was great. I got that, one of the first to get the new Johnson & Johnson vaccine today. It's a one-dose vaccine. It didn't hurt. My arm's not sore yet, but they tell me that might happen later, and I'm just feeling great. So we had a whole host of trusted community leaders in the faith-based community get their vaccine with me today, along with the Mexican consulate, Burmese ministers. So just an exciting process, along with making sure Mayor Hogsett, now that he's of age and eligible, was able to get his vaccine along with President City Council Bob Osley.
Good stuff. Dr. Kane, what's the difference between the shots? You kind of talked about it a little bit. Delve more into that. And can someone really choose which one they get?
Well, technically it depends on what site that they go to get their vaccination. They could call in advance and say, what vaccines are you offering? For example, currently at our sites, we're offering Pfizer and Moderna. We're hoping shortly and very soon to get the rest of our Johnson & Johnson vaccines. So you have three very effective vaccines that will be on the market now to really expand the number of people that we can vaccinate. I know a lot of people heard initially that both our Moderna and Pfizer vaccine has about a 95% efficacy. And when you look at this new Johnson & Johnson, overall, they say it's like a 72% efficacy. But if you just pay attention to what the effectiveness is just in the population in the United States, it is 85% effective in preventing any moderate to severe disease, hospitalizations, or even death. And let me explain it to you a little bit. So Pfizer and Moderna started their clinical trials way back in the summer. And this is when we were just seeing all of our strains for coronavirus, and we didn't have that many resistant strains. Now, Johnson & Johnson did their clinical trials started later in November. And by this time in our communities, different states, we were seeing much more resistant strains. So that efficacy of 85% now in an environment that has more resistant strains may actually be equal to that 95% of both Moderna and Pfizer, which did their vaccination way back in the summer when we weren't seeing all these resistant strains. So it's one dose. The side effects are very safe and very minimal, all the 3 vaccines. So take your pick.
Okay, yeah, Dr. Kane, thank you for that insight. Dr. Yaletti, I want to ask you about misinformation, because there's a lot of truth and misinformation mixed together. I personally have heard of these stories, maybe outliers, about people getting sick after getting the vaccine. What should people expect after getting the vaccine?
I think that's a great question. I think probably the most important thing to think about getting the vaccine is not which one or should I get it, is that do you want to get COVID or do you want to get a vaccine? Because the idea is if you get COVID, you have a chance of being hospitalized and dying. If you get any of the vaccines, nobody has gotten hospitalized or died. Even in the state of Indiana, we have over 1 million Hoosiers that have at least gotten 1 shot of the vaccine and 0 hospitalizations and 0 deaths. So I think we need to keep that in mind. There are some side effects. The side effects are good. That means it's actually working in your body. So you may get a sore arm, may get some fevers, may get some chills. Typically may last a couple of days and it goes away. But the thing is, that's much better than get COVID. And those side effects just mean the vaccine is working for you. And nobody has died from getting the vaccine. So I think we need to keep in mind, what are you risking getting COVID versus what are you risking getting the vaccine?
Ram, can I pipe in just a little bit,
Go ahead,
too?
doctor, yeah.
I think it's so important for people to realize that none of these vaccines contain a live coronavirus. These are man-made products that are making the vaccine. So you cannot be given coronavirus and get an infection from either of any of these 3 vaccines.
Kristen, about 30 seconds. I just want to bring Kristen into the conversation real quick. Will we have to get a booster after getting vaccinated, Kristen?
Yeah, so there is some, I think a lot of information is going to come out related to the booster. I know that Johnson & Johnson is looking into that possibility, and it is definitely a possibility moving forward that a booster may be needed. Similar to the flu shot, when different strains of the flu change year over year, and they have to adjust the formulation of the vaccine, you know, that may be necessary as these new variants spread. So it's exciting that a lot of companies are getting into just the vaccine production and really working on this, because we will really need that public health and operational infrastructure in the years to come to really support just the evolution of this technology.
Yeah, obviously it's a very fluid thing as well. One of the key questions surrounding vaccines, are the shots getting to all communities equally?
Yeah, so I want to show you the numbers right now from across the state. Out of more than 1 million first doses given, nearly 87% have gone to people who are white. There are the numbers right now. Only 4.6% have gone to black people. Less than half the 9.8% population rate. There is skepticism among the African-American community and other minority groups about getting the vaccine. So we asked Congressman Andre Carson about that.
Well, that skepticism is very well founded in a darker part of American history with the Tuskegee experiment and looking at World War II soldiers, black soldiers, who were subjected to experiments. And those are just a few things that have happened to African Americans. And so the suspicions are real. The suspicions are something that should be considered. I certainly carry many of those suspicions myself, rightly so, understandably so. But I think what has to happen is that we have to realize that many medical professionals, many of whom happen to be African Americans, would not put their professional reputations on the line to encourage people to get vaccinated.
Dr. Kane, that brings up a really important question. How do you convince people who are skeptical to get the vaccine?
Well, I think the first thing is that talk a little bit about who's involved in in developing these vaccines. You know, Anthony Fauci is probably the most well-known nationally, globally expert in the world. We'll never find someone like that in another decade. But the leading scientists for the NIH vaccine in collaboration with Moderna was a 30-year-old African-American black female who led the charge and has worked at NIH for over 10 years. You know, people forget. When we have an accident, you know, you might need a blood transfusion. Who discovered plasma? Dr. Charles Drew, an African-American male. So we have a lot of our scientists out there that are really trying to develop the right vaccine. But we want to avoid those, like Ram said, that 5% complications that may last months or years possibly. Chronic fatigue syndrome. You're so exhausted, you know, it's just a chore to just even make it to your bathroom. You can't even work. You're so fatigued. Or you may have brain fog. I just had a minister tell me about his brain fog. His memory's not there. He can't calculate. Simple things that you and I take for granted. That happens. Or you lose your loss of smell. Your house can be burning down and you won't even smell the smoke and the fire. These are chronic symptoms, and I know Dr. Uletti can talk to you about the impact on the heart, the myocarditis, the inflammation, because I know that's of personal significance to him.
Yeah, Dr. Uletti, I want to go to you next, and you're more than welcome to address that. But I want to ask your personal experience. Have you experienced skepticism from the minority communities? And how, as a medical community, are you ensuring that those who do not live in affluent areas are getting the same access?
I think you're absolutely right. I think, as Jenny said, it says we need to really educate people, not tell them to take the vaccine, but give them the information so they can make their own decision about it. They are worried that it's something that's being injected by the government into their arms. And so we need to explain to them why it's beneficial to get the vaccine. And importantly, tell them why is the vaccine more important to get than getting COVID? Because those are the same population that have high prevalence of COVID. So we're doing a lot of outreach into the communities. We have a lot of paperwork. We have a lot of brochures. We have videos, and really getting out to the population, as well as even in our internal company, Community Health Network. We're trying to make sure that even our own employees understand the benefits of getting the vaccine and letting them make the choice, do they want the vaccine or not. But a really big educational marketing as far as we can reach to get the word out.
Okay, and we want you all to be a part of our conversation this hour. We invite you to share your comments with us right now, questions on the Wish TV Facebook page.
Yeah, News 8's Alexis Rogers has been following the conversation. She joins us in studio with more. Alexis?
You know, it's so important to us for ourselves to hear you guys in this conversation. So it looks like Terry Carr has a question. He says, my question is, if only a percentage of Hoosiers or America gets the vaccine and a percentage chooses not to, who makes the decision that we can go back to not wearing masks again? I'm not going. So that's where Terry is. Let's see, Anita Sharon says, which vaccine are they getting? And I would probably add to that, or have already gotten. And the next comes from Nicholas P. He says, when can everyone get the vaccine? Which is a big question that we're seeing all over all of our social media as well. So of course, keep asking these questions. We want to get you answers.
Alexis, thanks so much. And you know, Phil, that is something that I think a lot of questions are surrounding upon. If you get vaccinated, why do other people who are not at the high risk categories need to get vaccinated? Can you still infect people when you're vaccinated?
Yes.
Have you heard the same concerns?
A lot of questions, yeah. I mean, especially when you're talking about social media. Dr. Uletti, you want to maybe take it away and answer a few of those questions for us tonight, sir?
Yeah, I think the reason that you still need to be, you could still potentially infect other people. So it's very important that you actually get the vaccine, but still be cautious. The hope is with the J&J vaccine, they're really ramping up in the next couple of months. And I think President Biden has said by the end of May, there'll be enough vaccines for everybody in the United States. One thing you got to remember also is that we've had millions of people already get COVID. So between all the people that actually got COVID, the number of people that actually have to get vaccinated to achieve herd immunity is not that much. So there's a lot of hope that in the next couple of months, March, April, May, the vast majority of America would get vaccinated. And remember, it doesn't matter which vaccine, as long as you get vaccinated, you're not going to get sick from it. You're not going to hospitalize. You're not going to die from it. So it just depends on just getting it as quickly as you can And really by the next 2-3 months, every American in the United States of America should be able to get a vaccine in their arm.
Kristen, I'd like to go to you, and maybe you can answer which vaccine you plan to be getting if you haven't already. But also on top of that, what are the main questions that people are asking you? What are you hearing?
Sure. So the answer to the vaccine was I got the one that was available to me at my earliest convenience of eligibility. So that just happened to be the Pfizer vaccine that I took in the clinic that I helped to run. We have, in the clinic that I helped to run, have been able to vaccinate over 60,000 people with a lot of really great success. And there have been a lot of questions. And just this past week, an African-American man, Tom, came up and he was really nervous. He had a lot of concerns. You could see fear in his eyes. And I took him aside, stepped out of the registration line, and just answered his questions and took time. So I think it's okay to make your appointment, to show up. We want to answer your questions. Our team members are really passionate and they believe in this vaccine. The safety and efficacy data is there, and we will be there for you. So if you're on the fence about the vaccine, if you're nervous, make the appointment and show up. And we are more than happy to walk you around the clinic, answer your questions, and really take the time with you. I mean, this is our time to be there for each other. We have been through so much this past year, and this vaccine gives us hope that there is a brighter day ahead. So please do come in, even if you're nervous, and we'll be there for you.
Get it done. Kristen Kelly, thank you very much. Dr. Giletti, always good to see you, sir. Dr. Kane, sit tight. We'll be back with you momentarily. Hey, we invite you to join the conversation. We want to know, will you get the COVID-19 vaccine so far? 48% say yes, they will. 32% say they have already gotten it, and 19% say no, they will not be getting it.
Head to wishtv.com to cast your vote. You'll also find links on how to register for the vaccine. Then follow us on our Facebook page. Let us know your thoughts. We'll be back. The next crisis, why health experts are growing concerned about the mental health impacts of the pandemic.
You're watching Wish TV, Indiana's only statewide TV news network.
An invisible illness is sweeping the country. The mental health crisis has skyrocketed across the nation and across Indiana, and it's something that's affected most of us.
But as News 8's medical reporter Dr. Mary Gillis reports, just because people get a vaccine injected into their arm doesn't mean it will go away.
Anxiety, depression, among other psychiatric disorders have plagued the nation for years. Now, with the coronavirus pandemic, so many more are struggling. And according to this one doctor, mental health issues are strongly linked to this one thing, something we're not doing anymore.
Eyeball to eyeball way with each other. It's really increased the feeling of loneliness. And so if anybody that's listening to this has experienced loneliness and thought, no, it must just be me, I assure you that that you are having a common experience that so many others are having.
The number of people battling poor mental health is staggering. According to a new report released by the Kaiser Family Foundation, millions of people across the U.S. are struggling with COVID-19 induced stress. As of January 2021, adults reporting symptoms of anxiety and/or depression rose to 41% from 11% in 2019. And substance abuse disorder is up 12% from July 2020. But turning to a substance, it doesn't help.
Because of this brief kind of sedation or relief from the anxiety or the depressed feelings or the grief, that can be terribly reinforcing in terms of behavior. Well, it worked this time even for a little while. And so I'm going to try this again tomorrow.
This is common, Fretwell says, when a person reaches a level of stress that feels overwhelming. But the most important thing you can do is identify something is wrong, find support, and seek treatment. Dr. Mary Gillis, Wish TV, wishtv.com, and follow us on Facebook.
Eye-opening numbers there. With vaccines now being administered, there seems to be a light at the end of the COVID-19 tunnel, but that doesn't erase what has been a really challenging year for a lot of people.
Yeah, joining us now to talk more about the impact the pandemic has had on our mental health, Carter Kramer, the lead psychiatric nurse practitioner at IU Health Behavioral Health, Alicia Johnson, IPS superintendent, and staying with us is Dr. Virginia Kane, director of the Marion County Public Health Department. Good to see you all. Carter, we'll start with you. Let's talk about the impact you have seen personally from patients being more isolated and having to wear masks. What are you seeing?
Absolutely. So I work primarily in the emergency department, servicing virtually 15 different emergency departments throughout the state. And we've definitely seen a lot more patients presenting with anxiety, depression, thoughts of wanting to hurt themselves as a result of sort of the stressors of the pandemic. And then also those patients that had pre-existing mental health conditions before the pandemic, if they were anxious before, they're more anxious now. If they were depressed before, they're more depressed now. So that's definitely something that we've been seeing, and definitely an uptick in our mental health patients.
Dr. Kane, will lean heavily on you here. Talk about numbers. Have you seen an increase in the number of addiction and overdose cases during the pandemic?
So we definitely have. You have to realize that a lot of people have lost their jobs. Okay. Concerned about whether they're going to be evicted from their apartments. And then you have some of the groups who have those frontline jobs, so they're at a higher exposure to individuals who may have coronavirus. So that's an added burden upon them. And when you have to go to telehealth, how many of our residents may not even have a primary care provider? So how can they get those resources or that counseling to help support them? So that stimulus package that we're going to hear about coming soon, that's important for people because we've seen an increase of folks becoming homeless. So mothers with their children sleeping in the car, having babies. So folks who may actually get the COVID infection and end up in the intensive care unit, they're intubated on a respirator for weeks, months. And if they're able to survive that process, it's sometimes like post-traumatic stress syndrome once they get out of the hospital with that added burden of anxiety and depression. And of course, if they don't have a primary care provider or they don't have insurance, they start self-medicating themselves. And then we unfortunately can see an increase in illicit drug use because they want to have some days or some moments where they feel good.
And Alicia, we want to get to you and talk about kids specifically, but before we do, I want to go back to Carter because you talked about an increase of depression and anxiety. How do you combat it? I mean, I think all of us have felt this sense of loneliness at some time or another. At what point should be the alarm, the red flag that says, I really should talk to somebody about this?
Yeah, I think when you start to have thoughts where you're feeling trapped and you are feeling hopeless, helpless, and then of course, if you're having any thoughts of, wanting to hurt yourself, we have seen an increase in suicide attempts and suicidal ideation come through the emergency department. I think, as that sort of starts to escalate, that's when it's time to reach out when you do feel that sense of hopelessness and feeling more panicked and more anxiety. So, whether that be to a family member, whether it be to a therapist, it could be a hotline, an online forum or community. There's lots of different ways to sort of get that help, but sort of doing that before you have to, be in the emergency department. And then I think, a lot of the times the pandemic has made a lot of people feel out of control and as if they don't have autonomy sort of over their life. So I think, in trying to sort of reframe things and focus on that in your life, which you can control, even if it's just a small thing like organizing the cupboard or going to bed 30 minutes earlier or trying to limit the amount of time spent on social media. Those are ways that you can try to sort of ground yourself and make yourself feel a little bit more in control.
Alicia, let's talk about students across central Indiana, specifically here in Marion County. Mental health issues, are they dealing with them as a result of this pandemic, in your opinion?
Yes, I'd say absolutely. We don't have our students sort of isolated, our children in bubbles. They are experiencing this pandemic in the same way that we are as adults. And so Those of us who are in schools and working with students every day know how important it is that we're not just talking about and meeting academic needs of our students, but we are also connecting with them in terms of their social and emotional needs and their mental health and how they are feeling and doing and processing what's been happening around them this last year.
Such good insight. Thank you, all three of you. And we want to just talk to our viewers for a minute and tell you, if you're going through something right now, remember, you're never alone. Free help is available. The Substance Abuse and Mental Health Services Administration runs a national helpline. That number is 1-800-662-HELP. That's 1-800-662-4357.
Also, the National Suicide Prevention Lifeline also provides free 24/7 help for anyone in distress. That number, 1-800-273-TALK. That's 1-800-273-8255. We've included all of this information on our website, wishtv.com. Coming up, returning to the classroom, how one of the state's largest school districts is now working to reopen schools and keep kids, teachers, and staff safe.
You're watching Wish TV, Indiana's only statewide TV news network.
Welcome back. Over the last year, students, teachers, and parents have had their lives turned upside down by the COVID-19 pandemic. From all virtual learning to hybrid learning, the journey has been far from normal.
Yeah, back with us to talk about education during the pandemic, Alicia Johnson, IPS Superintendent, Dr. Virginia Kane, Director of the Marion County Public Health Department, and Carter Kramer with IU Behavioral Health. Alicia, we'll start with you. IPS has been gradually welcoming students back. How has the process gone so far?
Well, so far so good. I'm very pleased and thankful to say. So we've been able to have, as you've gone through the list of all the different modalities we've been in this year, we've been back with our students, those who chose in person since January. That's been going very well. I'm very thankful for Dr. Kane and her guidance, as well as our community in doing what they need to do so that the spread rates have decreased, which makes it safer for us to stay in school. But so far, so good.
Alicia, studies have shown that it's possible to open schools safely with low transmission among students. Is that what the district has been seeing on your end?
We have. It's really mirrored what's happened in the community. And so when we saw those rates spiking like we did back in the late fall, November timeframe, we were seeing those same things play out in our schools. Now that the community spread rate has become significantly lower, we're seeing that trend play out in schools as well. So it really has mirrored what's happened in the broader community.
That's great news. How are you assuring kids, maybe even teachers and staff more than kids? Are kids the ones who are most concerned that class will be safe?
You know, we were really nervous before we brought students back around mask wearing. It was going to be so different, and we're concerned about students getting into that habit. That has actually been not an issue. And so when kids understand this is the way we sort of have to do business to be here together, they've done a great job of meeting that requirement. And for our adults, we were very intentional, even before we returned in person, to be clear about what our health and safety protocols were, to communicate those often and frequently, so they could know that we were doing everything possible to be sure that they were in as safe of an environment as we could create for our students and also for our staff.
Carter and Dr. Kane will get you folks in just a moment. This is just a really heavy education segment here. So, Alicia, how is the district helping kids who are falling behind, maybe because of a lack of reliable internet or technology?
A couple things we knew we had to have in place this year, which was technology for every student and access to the internet for every student. So again, at the beginning and prior to the school year starting, we made a massive purchase, over $16 million. For technology for our students, so that every single student could have a device, so that we are now what's known as a one-to-one district. We also have purchased over the course of this year over 7,000 hotspots, so that students who don't have internet access at home, the school district's able to provide that for them, so that no matter the learning modality, no matter if they're in person or learning from home, they have access to instruction, they have access to their teacher, and they can be a part of their classroom community. So it's been a massive investment, but was really a must-have given the context we've been in.
And just honestly talking, what do you think might be some of the long-term impacts on kids and learning as a result of the pandemic? What are some of the things discussed with your level behind closed doors?
Sure. I'll tell you, every superintendent I've talked to locally and nationally is thinking about this question. We know the year has been a year that has disrupted learning for our students. And so as we hopefully are on the other side of this pandemic, all the conversations are about recovery, are about accelerating student learning. And so that looks like considering things like longer school year or a longer school day, tutoring services in places for students on the weekends or after school. How we're also equipping and supporting our teachers. It's been a massive shift for them. And so how are they being supported this year, but also as we think about the future and the acceleration of student learning that we need to do. So that question is on every single school leader's mind right now.
I want to bring in Dr. Kane here real quick. Earlier this week, Doctor, President Biden called on states to vaccinate all teachers by the end of the month. Is the county prepared to do that?
Well, we'd like to be prepared if we can get sufficient vaccine in order to do it. We have over 20 teachers and staff that would be required to get vaccinated. Currently, right now, at least for our health department clinics, we receive about 5,000 doses per week. So for us to just concentrate on the teachers, it would take us at least a month just from our health department site of doing vaccinations. Now, when we look at how much vaccinations is taken every day across the city, it's about 1,677 doses we're averaging per day. Though we were doing more just before the snow epidemic, so we're going to have to kind of catch up a little bit. But it's going to take probably longer than a month, at least in the month of March. Now, I think things are going to just explode wide open in April. I think we're going to get hundreds, probably 100 million doses across this country in the month of April. I'm just not sure by March we'll get sufficient additional Johnson & Johnson vaccine, but it could happen by mid-March because they're now utilizing other pharmaceutical companies to duplicate the vaccine. Merck with Moderna, Pasteur Sanofi are helping produce vaccine for Pfizer. And so we're getting all these partnerships. So we're gonna have tons of vaccine, I anticipate, in the month of April. So we gotta be ready. So when we get that vaccine, we are ready to go.
All right. Well, we invite you at home to join our conversation tonight. We're live on Facebook right now.
Yeah, Alexis Rogers joining us now following that conversation. Alexis, what are you seeing, ma'am?
You know, a lot of conversation about parent resources as well as what happens once our kids are there full time.
Okay, Alexis,
You know what,
I'm going to
Alexis?
take it because I don't think your mic is on right now. But if you want to zoom in, we can read that as you turn on your mic, Alexis. And this one says, my kids went back in August, but I do wonder what will they learn as far as statistics of kids falling behind. My fourth grader has been fine, but my first grader was virtual for the last quarter of kindergarten and is way behind.
Conversation that we've been having a lot with parents, especially on Facebook. Also, let's see, Brittany says, when will there be a vaccine that's safe for kids? Because that's when I'll be sending mine back to public school. Another two very big conversations that have been happening all online have been what are the resources available for parents, especially as a lot of these changes keep going. And that's been a very big education conversation, kind of mixing with the mental health conversation. So, of course, we want to keep hearing from you.
Yeah, you know what? We want to go back to Carter for a second here and talk about mental health because it is an important topic, Carter. Would you recommend, in your professional opinion, not looking back and just trying to focus on the future?
Yeah, I think being future oriented is quite important. I mean, I think we have to recognize what didn't work, especially as we're talking, you know, I've heard from lots of my patients that I see in the emergency department, young teens and kids, that, you know, online schooling was not the greatest for them. Their grades slipped. They weren't able to stay motivated. I think for a lot of kids too, going to school was sort of a safe haven if they didn't really feel as if their home environment was all that great. And then and they sort of lost that and were at home. So I think we have to recognize that. But yes, being future oriented and sort of learning from, how things had gone, and trying to sort of pick that up and move forward and, can continue to grow there.
Alicia Johnson, I know that a lot of parents are in the same boat as that one who wrote on Facebook regarding their kids falling behind and really fearing for what next year will bring in their academics. I've heard it a lot from parents. What should parents be doing? Should they be fearing what's next? And how do you kind of put their minds at ease about this?
Sure. I would say not to fear. And I'm a mom. I have 3 school-age children here at home as well, so can certainly connect and relate to that sentiment. But I wouldn't say to fear. One is to know that your school, your teacher, your principal, your superintendent is thinking about that question and planning right now for what that next year looks like. And so to the extent that you are on the lookout for information from your district around things like summer learning opportunities. So there will be that offering in most schools across certainly Marion County, and even a community-wide effort around summer learning for our students that I would encourage parents to take advantage of if they can. And then as the school year starts, to have, real conversation with your child's teacher around, here's what I've experienced, here's where I think he or she or they has done well, and here's where I think we might need to focus. And so obviously the teacher has the expertise in instruction, but you're plugged in as parent, your child best. And so share that information, keep it an open dialogue and open communication so you can ensure your child is getting their needs met best.
All right, coming up, thousands of Hoosiers out of work due to the COVID-19 pandemic, what to expect for the rest of this year, and how you can help area businesses bounce back.
You're watching Wish TV, Indiana's only statewide TV news network.
Well, the COVID-19 pandemic has left permanent scars on the U.S. economy. While the economy has recovered from when the pandemic started last year, the job market is still struggling.
The question on everyone's mind now, where do we go from here? News 8's David Williams has the story.
These boxes of food being loaded into her trunk mean a lot to Angie Almonte and her family.
Milks, cheeses, cereals, a lot of stuff. Very good stuff.
She lost her job 2 weeks ago because of the coronavirus pandemic.
Not good. It's not feel good.
She's not alone. Ball State economist Michael Hicks tells me Indiana's down a full 100,000 jobs since this time last year. Not everyone experiences this downturn the same way. Hicks says individuals making about $60,000 or more are generally in a slow growth year nationally. Employment is down 4% for people earning $27,000 to $60,000 a year, he says.
But if you're in the bottom third, that's $27,000 a year or less, about 1 in 5 workers are unemployed or working less than 10 hours a week. And so that group of Hoosiers really faced a deep shock from this downturn, and they're really need to be the focus of the stimulus payments that we're seeing.
But there is economic recovery in the air.
Our economy is slowly recovering. We're forecasting growth of 2% for 2021, but things are looking up for the state. The vaccinations are going quickly. People are more likely to return to normal earlier than midsummer, as we had predicted, and that would tend to boost the prognosis for this year upwards.
While Almonte searches for a new job, she chooses to stay positive and even help make sure her neighbors get some of this food.
Like the people can drive or don't know about this, so I help the people.
Hicks says there are several ways you can help Indiana's economy today. He recommends going to a local restaurant, buy local. If you do go out to eat, he says tip generously. Also, visit other parts of Indiana to vacation. That, he says, will help cities and towns. In downtown Indianapolis, I'm David Williams, Wish TV, wishtv.com, and follow us on Facebook.
Well, the COVID-19 pandemic has impacted Indiana businesses large and small. Gary Dick with Inside Indiana Business joins us now to discuss some of these impacts. Gary, I want to start with small businesses. We obviously know the obvious reasons that they are suffering, but they are in survival mode. Talk about the technical issues that small businesses face that maybe chains and large businesses don't.
Yeah, you're right, Brooke. There are some obvious answers, I think, to this. One, small businesses just aren't set up like large businesses are in terms of perhaps large amounts of cash, access to capital, credit lines, those types of things that bigger companies can use to weather economic downturns. When you get into a catastrophe like the pandemic has brought on, it's especially difficult for small businesses who don't have rainy day funds, who don't have that access to capital, some living paycheck to paycheck. So the pandemic has presented special challenges, especially to those small businesses, minority-owned businesses, women-owned businesses that perhaps are in areas, more difficult areas that have been hit harder by the pandemic than other areas. So it's a compounding effect. And certainly small businesses in Indianapolis, central Indiana, and throughout the state are really, in many respects, in the same boat.
Many studies have pointed out that the pandemic has disproportionately impacted businesses owned by women and minorities. Is that the case here that you're seeing?
I think Indiana, central Indiana, facing the same challenges as exist elsewhere. One of the interesting things when you look at minority-owned businesses and the fact that there is disparity, continues to be disparity between minorities and white business owners in home ownership. The bottom line on that, so many small businesses may take out home equity loans to help fund their small businesses. Minority-owned businesses don't have the access that their white counterparts do. So that's been pointed to as one of the factors there. But certainly women and minority-owned businesses that face challenges outside of the pandemic exacerbates that in a big way.
On a more hopeful note, Gary, the Big Ten, March Madness, all descending upon Indianapolis next week. What are you feeling? I know seeing the bracket on the JW is just bringing immense amount of hope for everyone. What do you see as far as this being an economic boost to the city?
Well, number one, it's going to be with the entirety of March Madness, and as you mentioned, the Big Ten tournament as well, being here. The estimate early on was $100 million in economic impact. But here's the thing, in talking with Chris Gall at Visit Indy, he said this is opportunity. This is Indianapolis's opportunity to shine and to kind of present itself to the rest of the country, that we as a city can host these big events. So $100 million economic impact, I think with fans up to 25% in some of these venues being there, that's going to add potentially substantially. But what this could be, or what this does present, I guess, is an opportunity for Indiana to show the rest of the country and the meeting planners and event planners who say, well, how is Indianapolis hosting these events when others can't do it? It could be an opportunity to really attract big time, more investment, more meetings, and get those sooner than perhaps otherwise existed. And one other thing I'll mention, Brooke, is Visit Indy, the Indiana Sports Corporation, state and local health officials. A lot of people say, hey, they've done a great job in making it possible to host these kinds of events when other places can't do it. McCormick Place, the massive convention center up in Chicago, they just found out they can only have 50 people at that massive facility until June 1, whereas Indianapolis, other parts of Indiana, hosting events. So it gives hope, opportunity for the future.
Good conversation. And still with us tonight is Dr. Virginia Kane, Director of the Marion County Public Health Department. Also joining the conversation, Kyle Anderson with the IU Kelley School of Business. Kyle, we'll start with you on this one. What would you say is the outlook for the economy here in Indiana and across the country?
So I think the outlook is really pretty good. We're excited for the vaccine. Obviously, it's been a struggle the last 12 months in terms of jobs, in terms of income. Just a lot of us have felt the heat. But I'm feeling pretty good about where we go now that we're getting some vaccine distribution and things are hopefully going to resume to normal quite soon.
Well, the economic impact from the pandemic really has not been very equal, especially for many women. Number one, why is that? And what needs to be done to address that issue?
So I thought Gary did a great job talking about women in business and that women-owned businesses face unique challenges and different access to capital. But we look more broadly, one of the things that it really is affected because of the closures of schools just tend to impact women more. More women have dropped out of the labor force to stay home with their kids. And so they have been affected more broadly with the healthcare and family-related issues.
Dr. Kane, Marion County relaxed some restrictions this week. When will it be safe to fully lift the restrictions?
Well, I think, quite frankly, it's going to look at our data based on the science. And so how long can we keep our metrics of our positivity less than 5% and the number of new cases greater than 35? The easy answer, though, is to say when we have our community at what we call 80% of our folks vaccinated, that gives us what we call herd immunity. That will be when we're the safest, and I'm hoping that's going to happen sometime, of course, in the summer.
That's good to hear. Kyle, one last question for you. What will the impact of the pending economic stimulus bill be? Is it needed?
I think it certainly is, and there's certainly elements of it that are absolutely needed. Gary talked a lot earlier about small businesses are still facing huge challenges. And so the federal government definitely has a role in supporting those businesses and things like extended unemployment. We're not back to where we were a year ago. And so there are tremendous benefits that are absolutely necessary for us. And the sooner that we can get that into folks' hands, the better off we'll be.
Dr. Kane, what does the outlook look like for events this summer?
I think it looks very promising, Phil. So I'm excited about our opportunities for the summer. And I think as you see the vitality of this community grow more, and you see the response from our communities trying to make us a safer environment, I think this is the city to watch in this country. Take us on. Look at us, okay?
Good stuff. Dr. Kane, thank you. Kyle, thank you.
All right, we love to hear that, don't we? Well, we have really enjoyed seeing everyone chime in on Facebook tonight. News 8's Alexis Rogers has been following all of your comments and reaction. What have you been seeing, Alexis?
You know, a lot of conversation about what happens, especially when it comes to unemployment, especially when it comes to helping out people who might not have a place to stay. Cheryl Petrie says, what is the plan for the homeless population in Indiana? And this is a big deal, Brooke, because a lot of the folks who have businesses, and maybe they have businesses in places where a lot of people who are experiencing homelessness are, this is a very big question for them, and we've seen a lot of business owners talking about this. Our next one is Sandra Evans. Sandra says, the income limit makes total sense to me as long as all of those families are still working and making that kind of money. What if they have been out of work since the last time they filed taxes? This has been a huge thing because many families have situations that have changed so much in the last year. So this is a lot of the economic conversation that we're seeing amongst a lot of our viewers.
And Kyle, we want to bring you in here. You're looking at those questions. Your thoughts?
Yeah, so I do think we want to target the financial benefits, the economic stimulus to families that really need that help. And your Facebook viewer was very much right on. That's not always easy to do that. If you're looking at data from a year or two ago and trying to decide who's eligible and who's not, then it's not always easy to identify that based on old data. And that's why the federal government has largely gone to giving more money more generously than maybe some people think that they should.
Dr. Kane, I do want to address the homeless population and the situation, especially down near Monument Circle. It's a two-pronged question, right? Because we are seeing an increase in our homeless population. We're also seeing businesses struggling, not wanting loiterers on the sidewalks outside of their business. What is the county seeing in regards to that?
I think the key thing is, and I should, just for disclosure, I'm on the Blueprint Council for the Homeless. There are stimulus dollars out there to help address our homeless populations. And this is the time where we really got to put all of our resources in the basket to have a stable home for people who are homeless over their heads. Now, granted, some of our clients may have some mental health issues and may have difficulty being in an enclosed shelter. But hey, let's make the availability and the access help happen for our homeless, and we can make it happen. But we've got to work through a lot of our bureaucracy. We have to do more collaboration with the different agencies, and this is our best opportunity ever to address the homeless. And if we can address the housing stability for our homeless, then you'll see less of those clashes between the businesses and the folks that are downtown and are homeless who loiter in that area because they feel they may have more resources like food or some social networking with the other homeless down there. So we can duplicate and make those resources better for them. And that's our goal.
Dr. Kane, yes or no question. 1 year from now, we do another one of these. Things are going to be better?
Oh, absolutely.
Boom.
This
Love it.
country's going to recognize that we could put on the NCAA in a bubble and put a stamp on this country in terms of we can meet the challenges like no other challenge. And I just have to say, we got a great mayor in Hotset.
Yeah.
We got a great city council with all our leaders, our county commissioners,
All right.
Chamber of Commerce, and of all people.
That's all of our time. I'm
It's
so
the
sorry to
media.
cut you
It's
off.
the media because you get the
Thank
message
you.
out for us. Thank
You can watch this whole show again on wishtv.com.
Have a good night.